Hello and welcome to the Chiropractic Society of Rhode Island's podcast, Get a Spine. My name is Dr. Michael Gottfried, and with me today is Natasha Perez of Trine Company, and she is a woman who is trying to make a difference in an otherwise somewhat ignored population. She's trying to create wellness in low-income senior housing populations. So with that said, I'm going to go to Natasha to give us some background of who she is.
Hi, Dr. Godfrey. Thank you so much for the introduction. I really appreciate it. So I'm Natasha Perez, the founder and CEO of Trine Healthcare. And at Trine Healthcare, we try to improve the public health by providing on-site wellness programs in affordable housing communities. Services that we offer to our residents are wellness checks, healthcare screening, vaccination clinics, case management, scheduling transportation to and from doctor's appointments, healthcare education classes, one-on-one technology help, and a cyber senior program for those who need a little bit more assistance. So throughout my healthcare career, I started out as a healthcare administrator and then moved on to working at a doctor's office for primary care for adults on Medicare. And through that experience, I've seen a lot of gaps in healthcare and a lot of inequities for minority and low-income groups. So many issues that these groups have are a lack of access to quality healthcare, technology, language and literacy barriers, as well as a large mistrust of the medical community and really a lack of knowledge about healthcare, especially regarding prevention and their chronic conditions. And so by providing our on-site services, we're really able to build a deep trust with our members and connect them to their healthcare services, hopefully improving the public health for all.
So yes, and we talked a little bit about that, and I really appreciate what you're doing. So your background then in healthcare services is what helped you formulate this idea of what it is that you want to be doing? Because again, it's not perhaps the most popular avenue for people to take when they want to get into working in wellness in healthcare.
Yes,
Tell me a little bit more about that thought.
That's true. So when I was a healthcare administrator for assisted living communities, I saw a lot of, I worked more on the spectrum of end of life for folks. And as much as I love helping all those families and all those residents, I really have a passion for wellness and prevention. And I was always hopeful that at some point in my career, I could move on to wellness and prevention because I really see the capacity for better health, especially for our aging citizens. I was just speaking to a friend of mine the other day. He just turned 80 years old and he can leg press 320 pounds. I mean, if that's not living well, I don't know what is. He still travels. He's very vibrant. So that's a real passion. That's a hope for all, for me. And then when I started working in a primary care practice, I worked for a company that provides a value-based healthcare for adults on Medicare. And so their focus is prevention. Their focus is wellness. And what I noticed were it's a little bit hard to connect to different groups. So if you are savvy about healthcare and you have access to technology and people around you to support you and you have a basic knowledge of healthcare, it works for you. It works. The healthcare system works for you. But I've seen a lot of folks, unfortunately, that don't have that level of knowledge. They don't have that access. They, like I mentioned, there's a lot of language and literacy barriers. And I just feel deeply passionate to help folks out. And I do believe that when we help people that need more assistance, that don't necessarily have the access that, say, you and I do, we really create better communities for everyone. So our children are safer, our neighborhoods are safer. We won't have as widespread of a pandemic. So it's just something I feel very passionately about, and I see that it works, and that's key. It's one thing to be passionate, but if it doesn't work, there's no point. But I do see that it's working.
And we did talk about, so many things came up for me as you were talking, but one of the things we talked about was, again, you'll need to be documenting, and that'll be something that will be important for you to, do some statistical analysis of what the level of health is for the population that you're dealing with, and then how that gets influenced, hopefully, certainly positively, further on down the line. So you have some thoughts on project that you might want to put together on that?
Absolutely. So I've been reaching out to insurance companies as well as private practices and healthcare companies that have our patients on their panel. And I would love for someone to step up to the plate and help us with a study to see if the folks that are enrolled in our program have truly better healthcare outcomes. So there's a lot of documentation that I do on my end, but they have their members or their patients' data over several years for some of them. So I would like to see, with these supportive services on site, are there better empirical data that their healthcare outcomes are improved? So we have folks that go to, say, Brown Medicine, Miriam Hospital, Providence Healthcare Clinic. I would love to work with some of these agencies and try to run a study with the program.
We'll see if we can help out on that. So that 80-year-old certainly is an inspiration. I used to play tennis years ago with an 83-year-old who, unlike most tennis players at that age, stopped playing singles and play a very weak brand of doubles. But this one particular guy was still very much into competitive tennis. And in his 80s, he had a van and he would travel up and down the East Coast and enter tournaments
Wow.
and play singles. So he was pretty amazing, to say the least.
I love
So
it. I'm
yeah,
sure you've heard of or probably read, there's so many studies on staying active and how that benefits us, not only physically, but mentally as well. And with this pandemic having isolated so many people, I see it at my building all the time. We never stopped providing classes in the building. There was a point where we had to stop doing group exercises, but then we would still work with folks one-on-one. And our folks did not report feelings of depression or sadness because they were connecting with us at least one-on-one, at least some human contact one-on-one. They couldn't do the group exercise or events anymore, but at least they still got that connection. And exercise just keeps those endorphins pumping. So it's very, very important. Keep moving always.
exercise and endorphins, very important. And again, your connection with the people is so powerful. And we talked a little bit about a past study that I was involved with and other chiropractors in Rhode Island with a group called AMI, and it had to do with bringing what's called alternative integrative medicine to a population again that typically wouldn't get it, and we were statistically able to really show dramatic changes for the better in
Yes.
keeping them out of the ER and decreasing their drug dependency. But the key to that, that really made it work, was the nurse practitioners who reached out to that population. And as you had talked about with me, really kind of helped them through the process, kept them getting to their appointments, all the things that might fall by the wayside if they were on their own.
Yeah, it's true. I see it often. I see folks reluctant to go to their doctor's appointments. Oh, well, it's COVID. Well, I'm not really sure. I feel okay. I'm not really sick yet. And we really work with them, encourage them, get them to open up, get them to talk to us about what's been going on and why it's important to go to that doctor appointment. And we can help facilitate telehealth appointments if they're worried about going into a doctor's office. I think just last week I was on 3 telehealth appointments with folks. And that's really important, just helping them walk through the process and build some trust. Unfortunately, the medical community has not been kind to these folks oftentimes. And also sometimes they just want us on the call to help them understand what this doctor is talking about. Oftentimes they really just don't understand what is being said. And especially for folks with literacy issues, they might get a discharge summary from their physician or new medication. They can't read it. and the provider may or may not know that. So yeah, there's a lot of work to do in this space.
Well, we get paid the big bucks to use the big words that nobody can. But obviously that's pretty ridiculous. And I got to say, for somebody who should have a certain amount of ability to navigate through the healthcare system, just getting the second vaccine appointment has taken me hours of getting
Yes.
through these websites, and again, I have a certain level of knowledge. So take somebody who is either somewhat computer illiterate and or language challenged, and doesn't have that support, and they're in a lot of trouble. So you're
Yeah.
providing valuable service.
Thank you. Thank you. Yeah, what I found is they just give up. If they call a doctor's office and they're on hold for more than 5 minutes, they hang up. They give up and forget about going to a website to schedule an appointment. It's just not going to happen. If they have a child or adult child to help them, or a friend or a neighbor, okay, you might have a little bit more luck. But I mean, when I'm calling scheduling appointments for people, I want to pull my hair out. 45 minutes is a long time to wait on the phone, but I'm dedicated and I do it.
Really? Well, yeah, it took me an hour to get through on one of the websites today, and I did have to hang in there for sure. It's crazy.
It
So
is.
let's go back a little bit. When did you form the company?
In August of 2020, right in the heart of a pandemic.
Huh? So it's very new, right in the heart of the
It is.
pandemic. Good
Yes.
thinking. And tell me a little bit about some of the goals you have for the company, for future goals. What is it
Yes.
you'd like to see?
Yes, thank you. We're really excited about expanding this program, not only throughout Rhode Island, but to all the affordable housing senior buildings in the United States. So we started with a one-man crew, which was me. Now we're a team of 4, and we're looking to hire a provider, as well as a scribe, and probably a nurse practitioner as well. So it's growing. People are starting to see the need. A lot of our clients, the affordable housing owners, are scrambling right now to put the pieces back together, from the losses that they've experienced through COVID. But at least there's a little bit of light at the end of the tunnel. So I feel like we'll be picking up some traction. We did just put together an advisory council, which I'm really excited about. So we have a physician, we have an entrepreneur, we have a nurse, 2 nurses actually on the panel, which is great because they help give the company an outsider view of dynamics and other markets, and advice as to, how we can grow and expand more quickly, and how we can really increase our services to folks.
You brought up something that, again, was in my mind. What's in it for the owner of the apartment complex that you're approaching? Why would they, aside from being a benevolent person, which hopefully they all are, why would they want your services?
So I'm glad you asked that, because there's a couple of great programs available to them that incentivize them to add wellness services to their building. So there's a program called Enhanced Resident Services by Fannie Mae, and there's a Mark to Market program from HUD that does things like give them a higher loan to value ratio, increase their rents, their monthly rents from residents, give them a better interest rate, longer interest rate terms, to help them instill services like this on site. And what's interesting, the more building owners I talk to, some are very savvy, some know about the program, some have used the program, but some don't even know about it. And some folks are pushing to get all their buildings through this program, through the Mark to Market program, because they want to hurry up and grab the money before it runs out. So, that is a financial incentive for the building owners. But additionally, when their people feel good, they do good. So a lot of times, people, council members, neighbors surrounding these buildings will say, oh, not an affordable housing building. We need more affordable housing in this country. We really do. But you'll find a lot of neighborhoods that want to shoot that down in the development process, because not in my backyard. But if you have services that really help these folks, care about their community and feel healthier and do better, as I mentioned, it really does support stronger communities all the way around. And it also reduces turnover for the building owners as well.
Excellent, excellent. So you view the whole U.S. as your marketplace, huh?
Absolutely. You're ambitious.
Well, I would say there's a lot of room for expansion then, for sure. So
Yes.
good for you. So, Natasha, if somebody wants to connect with you,
Yes.
who's listening in, what would be the best way for them to contact you?
So they can always call me directly. My phone number is 401-684-4858, or they can email me directly, natasha.perez@trinehealthcare.org, or they can go to the website trinehealthcare.org, and there's an email filter on there. They can send us an email through that, and they can get more information on the website as well.
Terrific. So I really appreciate having you on this podcast today. Natasha, you are a woman who cares and is trying to make a difference. And that's what it's about. We all need
Thank
to be
you.
thinking more about other people and how we can make a difference. So this was Dr. Michael Gottfried with the Chiropractic Society of Rhode Island's podcast, Get a Spine. Thanks for listening.
Thank you, Dr. Michael. It was a pleasure being on the show.